Back to nursing education. Today, in this video, we're going to look at community nursing. In particular, we're going to focus on the homeless population, low income and homelessness. So I'm just going to read from the textbook and then have a brief discussion about this topic. Low income people are less likely to rate their health as very good or excellent and are more likely to suffer chronic illness and to die earlier than people with higher incomes, regardless of their age, their gender, their race, and place of residence. People who live in lower income circumstances are more likely to live in hazardous environments. So just thinking off the top of my head, yes, they live more in communities where there is more crime, and perhaps even the infrastructure, talking about the buildings they're living in, are not very safe. There's a lot of cockroaches, pests, rats, mice, which leads to a higher incidence of infection and disease. You have just things like that going on there in those kinds of environments. So moving on, you also have they work at high-risk jobs, so their employment is also a hazard to their health. They eat less nutritious diets because what else can they afford? They have to go to the dollar store, and often the types of food over there is not fresh. It's not fresh produce. A lot of it is processed and high in sugar, high in fats, and experience multiple stressors. So they have other things on their plate as well. Besides all of these hazards, they also have other factors affecting their mental and physical well-being. So people with low incomes face practical problems related to limited access to adequate transportation. So most of them are using the bus or the subway or have to walk, which poses another problem in and of itself, which is related to limited access to also quality childcare to support their employment. So they have to, on one hand, do I take care of my child, or do I spend the extra time working? So they have to, it's a delicate balancing act they have to do. There's medication and dental coverage from supplementary health benefits, so there's a lack of that because a lot of these jobs that they are taking on do not have these benefits. Low-income status is particularly prevalent among single-parent, mother-led families and unattached seniors. So these are, that's a fancy way of saying widows, and these are mostly female widows and Aboriginal Native families. So that's the low-income aspect of it. Now I'm going to move on to the homeless angle. So homeless people have even fewer resources than those who are living on low income. So you thought what I just talked about was bad? The homeless have it even worse. Their vulnerability lies in their social condition, their lifestyle, the environment they live in, which diminish their ability to maintain or improve their health, or their ability to gain access to quality health care, or even acceptable health care. Homeless people live on the streets or in temporary accommodations such as shelters and boarding houses. They tend to distrust health and social services as bureaucratic and normative, using them only when their health has deteriorated. So usually when it's too late, or not really too late, but it's a last resort for them. It's not used as a preventative measure, as I spoke about in my last video about health promotion, health prevention, or I should say disease prevention. So exacerbations or worsening of chronic health problems are common for them, for the homeless, because of everyday barriers to supportive self-care and medical care. There is a high incidence of mental illness and substance abuse among the homeless population. I'm going to comment about that when I'm done reading here. The nurse must help homeless people identify the capacities and resources they may have, their eligibility for assistance, and the acceptable interventions that may promote increased ability to improve their health status. So, speaking from experience, when I was doing my mental health placement in a homeless, uh, it was a homeless center, housing and homeless center. Yes, I did notice a high incidence of mental illness and substance abuse, which includes both alcohol and drugs. So one of the proposed remedies for this is to help the homeless to identify the resources they have, whether it's their own abilities to meet their needs or the resources that are available to them, such as perhaps employment opportunities or volunteer opportunities, networking of opportunities available for them as well, and just whatever social assistance that is available. But barring that, one has to almost think out of the box to adapt to the situation, whatever their situation is. And then you look at the eligibility that they have for assistance, whether it's from the government or, like I said, employment, and the acceptable interventions that would promote their ability to improve their health. So what would be acceptable interventions? Well, in the case of somebody who is an alcoholic or a drug addict, you would want to not promote that lifestyle. You want to discourage them from continuing that way. So there are, in our modern day, 2022, we have, there's something where they have traveling vans where they allow people to administer whichever drugs they prefer. So it's like a harm reduction kind of movement, which personally I'm against. I don't think harm reduction is helping anybody. It's only making it easier for them to continue that lifestyle. For example, you don't take an alcoholic and bring him to a bar. And that's exactly what they're doing. They're enabling them to dig themselves into a deeper hole. Instead, we should be promoting education as to the hazards of these kinds of lifestyles. We can offer them statistics or even anecdotes, even videos, just things that would discourage them. I mean, you have the on cigarette cartons, for example, on the cigarette cases and cartons, you have discouraging adverts, which would show you a diseased lung, and effective commercials like that. So that would be one way to address that. You want to, yes, you want to reduce the harm they're having on themselves, but I would promote a weaning methodology. So if somebody is, for instance, smoking a pack a day, you want to get them to smoke maybe a pack a week, eventually graduate, wean them off maybe a pack a month, and then eventually they'll just stop smoking altogether. Maybe they'll just smoke once a week, 1 cigarette per week, 1 cigarette per month, and then just phase it out. And you could do the same thing with alcohol and more hard drugs. So that's my discussion for low income and homelessness for today. It's such a complex topic, but I hope this shines a light on realistic, pragmatic solutions that are available. I mean, it's easier said than done to want to achieve these things, but it really takes caring people, and also requires people who are motivated to want to change and they want to get out of their situation. So that's all for this video. Thank you very much for your time. Please like and subscribe if you want more content like this, and more content will be released daily.